Welcome to the 2013 Bankmed benefits video. Whether you're new to Bankmed or whether you've been a Bankmed member for years, this video contains valuable information that is designed to assist you in making the best possible choice when it comes to providing medical cover for you and your family. Life is an ever-changing process, and this is a great opportunity to reassess your situation and your needs, not just in terms of medical cover, but also in terms of lifestyle and quality of life. Remember, at Bankmed, we're not just here for you when there's a health problem, we're also here to help you get the best out of life through making healthy lifestyle choices. I'm going to take you through the six Bankmed plans, what they consist of, what the plan does not include, how to select the best plan for your needs, and finally, how to submit your plan choice if you do decide to make a change. Collectively, the 6 plans have been designed to meet the needs of members across the Bankmed spectrum. Regardless of the plan you select, there are certain benefits that all members have access to, which include the following. Everyone has access to wellness and preventative care and benefits health screening, such as personal health assessments, individual stress assessments, HIV counseling, testing, and many other screening tests aimed at detecting illness before symptoms occur. A detailed list can be found in your benefits and contributions schedule. Further to this, everyone has access to unlimited hospitalization benefits. However, the nature of cover is defined by the respective plan, as well as a 30 days post-hospital GP consultation from insured benefits for 2012. Also, unlimited chronic medication for the prescribed minimum benefits listed conditions, and access to expert advice and counseling through Bankmed's special care programs. Nurses are perfectly positioned to assist with minor ailments, provide evaluations, coordination of chronic care, rehabilitation, and health education. So, we've introduced up to 3 nurse consultations per beneficiary per annum from insured benefits. Thereafter, this will be subject to your GP consultation benefits where applicable. We've also introduced a 24-hour advice line to support you should you have any health-related concerns outside of business hours. Probably the most significant addition to the 2013 benefits is the introduction of a new 6th plan. So let's take a look at each of the 6 plans and what makes them different. Our new plan, the PMB plan, is the most affordable plan, designed to cover PMBs only. You can read about the PMBs in detail in your brochure. We're using the term PMB a lot throughout this video. What we mean by this is prescribed minimum benefit, a list of benefits that are defined by the Department of Health. But you need to understand that should you require non-PMB medical services, this will not be covered. For example, a tonsillectomy or a non-emergency hip replacement. The PMB plan is good if cost is a real issue, but please remember that benefits are only via a network service provider, and that we do not recommend this to members with high healthcare needs or for pensioners. And remember, if any of these issues relate to you, you cannot change plans during the year. The basic plan offers comprehensive day-to-day cover via the CareCross GP network, which provides access to a range of quality benefits, including unlimited consultations, unlimited acute and chronic medication as per the CareCross protocols and medicine formularies. Access to specialist care is always via your CareCross GP. Also, unlimited basic dentistry, biannual optical benefits, and as mentioned earlier, unlimited hospital cover and access to wellness benefits. Changes include hospital benefits will include PNB and non-PMB benefits via a defined list of network hospitals. Please note that the basic plan is suitable for employees with medium to high healthcare needs but limited affordability. The Core Saver plan is for younger and healthier members with lower healthcare needs. You have a high level of in-hospital cover and unlimited benefits for the 26 PMB listed chronic conditions. Also, there are 2 GP visits per beneficiary per annum available from the insured benefit via the nominated Bankmed GP. and 15% personal medical savings account for day-to-day expenses. Please note that in addition, there are wellness and preventative screening benefits from the insured benefit via the Bankmed GP network. The traditional plan is most suitable for members with moderate or high healthcare needs. All healthcare expenses in this plan are paid from the insured pool, subject to specified annual limits, which has increased by 6% per category for 2013. Changes include specialist consultations referred by the Bankmed GP network are covered at 100% of scheme rate, but non-referred specialist consultations will only be covered at 80% of scheme rate. In other words, if you go to a specialist that is not part of the Bankmed specialist network, you will be liable for the difference in cost. Please note that the only other change for 2013 is the introduction of a wide but defined range of network hospitals. This plan has no medical savings account. Members are advised to register with a Bankmed GP and obtain their medication from the Bankmed pharmacy network. In order to keep contributions affordable and to avoid out-of-pocket expenses for members, we've introduced the Specialist and Hospital Network. This change to the plan allows us to effectively manage claims and quality of care. The comprehensive plan is suitable for members with moderate to high day-to-day healthcare needs. This plan gives you access to benefits through a combination of funding from the insured cover and your medical savings account of 18.5% of your contribution. From a change perspective, there has been a 6% increase in all category limits, and the insured optical benefit is now available every 2 years from last date of service. Comprehensive is a versatile plan that allows freedom of choice with regards to your medical service provider, but does not offer the above threshold benefits included in the Plus plan. The Plus offers comprehensive in-hospital cover and can be considered by members with high healthcare expenses. This plan gives you access to benefits through a combination of funding from the insured cover and your medical savings account of 25%. Please note, sub-limit accumulation to threshold has been introduced for 2013. All claims at 100% of scheme rate will accumulate towards the annual threshold amount, except self-medication and optical benefits such as frames and extras. Once the threshold is reached, members will have additional cover from the above threshold benefits. Please note that although you are not obligated to use the networks, it is to your benefit to take advantage of Bankmed negotiated rates. Plan increases are always dictated by the relationship between claims versus contributions, medical inflation, and cross-subsidization. In the case of the comprehensive plan, we have had to address an imbalance in the income category of 0 to 5,000 Rand in order to sustain the plan. But bear in mind that this increase will only affect less than 3% of the members. Should members choose to move across to the traditional plan, they will receive a reduction in contributions without a material loss in benefits should they utilize the Bankmed network providers. We strongly advise you participate in one of our health days, which is held at sites with a large employee base. The Health Day, also known as a Wellness Day, is a joint initiative between the employer and Bankmed, who invite various clinical and wellness practitioners to do preventative care screenings and to educate members on healthcare. Preventative care screenings can also be done at your Bankmed GP and pharmacy. Remember, this is a great way to complete your personal health assessment and to experience some of the innovative and fun ways of working towards a healthy lifestyle. Wellness and preventative care benefits are an insured benefit, helping members to identify any health risks that may need managed care via the Special Care Program. Additional benefits are then provided to either prevent illness or to assist the member to manage and monitor chronic conditions, thus providing peace of mind when you need it most. I would now like to take you through our 8-step guide to help you choose the most suitable plan for you. When deciding upon your cover, carefully consider your needs for the year ahead. What changes have taken place in your life? Will your claims in the coming year be similar to last year? Are you planning a family? Are you moving location? In which case, you need to ensure that you choose or change your CareCross or Bankmed GP network doctor to the one closest or most convenient for you. Should this be applicable to your chosen plan, have you been promoted? Have your financial commitments changed? What level of contribution can you afford? Consider the 6 different plans and assess the amount of day-to-day cover that you need and how you prefer to access these benefits. For example, if you're thinking about joining the PMB or basic plan, remember that with this, plan benefits are available via the CareCross network. You will find a list of CareCross practitioners on the Bankmed website at bankmed.co.za. The next step is to look at the day-to-day benefits of the various options. You will find detailed information of these benefits in your 2013 schedule. Though hospitalization is unlimited, some plans are restricted to a hospital network and category limits. An example of this would be a bone-anchored hearing aid that may not be covered on your plan. In addition, you will also note that PMB plan only has hospital covers for PMBs. You will find a list of these benefits in your 2013 schedule. The next step is to review the value-added wellness and preventative care benefits and special care programs available to all members. The next step is to determine how much your chosen benefit plan will cost. This is clearly an important factor in choosing the right option for you and your family. Simply follow the calculation steps provided in the schedule to determine your monthly contributions. Step 7 is about reviewing and making your choice. So go back to the questions that we set out at the beginning. What is your past claims history? Are you planning any medical procedures? Are you taking any medication every month? How many dependents will you have next year? What day-to-day benefits do you need? Can these be delivered through a network of practitioners? What monthly contribution can you afford? Throughout the video, we've referred to the Bankmed networks. Please understand that networks aren't about restriction, they're about collaboration. It's about leveraging the best quality care within the context of quality, cost, and service delivery. And, not least, it's about reducing or avoiding the possibility of out-of-pocket costs to you, the member. All that's left now is for you to send in your choice of plan. Remember, if you are not changing your plan, you don't need to fill in the form unless you wish to update any of you or your dependents' personal details, for example, ID numbers. There's a number of ways to make your choice: via the call center, website, email, fax, or post. But remember, you need to submit your request by the 19th of November. Otherwise, you will remain on your existing plan for 2012. We urge you not to miss the opportunity to make the right choice. You can also visit our interactive plan guide at www.bankmed.co.za, available year-round. It's a great resource for new recruits or those of you wishing to review scheme rates or service providers. Thank you for taking the time to watch this important overview. It's now time for you to take a close look at the 2013 benefits and contribution schedule to choose the best possible plan for you and your family. Whichever plan you choose, with us here at Bankmed, we wish you and your family health and happiness for the year ahead.